Subclinical depression and subclinical anxiety. I'll just read some of these kind of quickly to you. Subclinical depression was noted in 53% of people with non-alcoholic fatty liver disease. Okay, that's a ton. And clinical depression is in 14%. Subclinical and clinical anxiety was subclinical anxiety, guys. Anxiety. Everybody has that today. 45% and 25% respectively in people that have non-alcoholic fatty liver disease. I'm not joking around about smaller brains and cognitive impairment. Look at this. Besides fatigue, non-alcoholic fatty liver patients may also experience other symptoms such as anxiety, depression, cognitive impairment, and loss of self-esteem. What? Loss of self-esteem? I mean, did you ever think about that? I know there's the Chinese medicine people like, well, of course, the liver is the seat of anger and all these things. But for the average person, someone's walking around anxious, depressed, not thinking straight, and they're not feeling great about themselves. We're like, hey, maybe it's your liver. Usually in this industry, we're like, you need some amino acids. How about some tryptophan? How about some tyrosine? How about some echinopurins? We go for, how about some GABA? But all the meanwhile, it might be liver. This is looking at brain volume. Non-alcoholic fatty liver disease significantly influence cognitive deficit and tissue volume reduction in patients suffering from this, and 4 times higher risk of having cognitive impairment, which is not hepatic encephalopathy. Too much ammonia, but it's very interesting. Same deal, smaller total cerebral brain volume. And this was in women? No. Pointing to a possible link between hepatic steatosis and brain aging. And listen, you guys know brain aging is a huge thing nowadays too. There's a whole bunch of people that aging all has to do with your brain, and focus on your brain and, gargle, sing, and sniff essential oils. I'm not saying there's anything wrong with them, but here's my question. Why do they have brain aging in the first place? Are we focusing on the brain because that's the symptom? And that's why we're having people smell. And by the way, we have loads of essential oils in this house. I'm not knocking them. Love them. Probably like 5 diffusers. But we see the cognitive, we see the neurological things. We're like, oh, well, your brain's not working well. And we never stand back and say, well, maybe it's coming from somewhere else. Okay? And I'm not saying you guys know what I'm saying. All right, but it's not just the liver. Check out some of these things. Patients with non-alcoholic fatty liver disease have increased risk of end-stage liver disease, hepatocellular carcinoma, and liver-related mortality. You guys still with me here? I just had a blip on my screen. But the largest cause of death in these people is cardiovascular disease, followed by extrahepatic malignancies. Also, chronic kidney disease, extrahepatic malignancies such as colorectal cancer. Do you guys ever think of colorectal cancer and fatty liver disease? Psychological dysfunction, gastroesophageal reflux, obstructive sleep apnea syndrome, periodontitis, hypothyroidism, growth hormone deficiency, and polycystic ovarian syndrome, all from as extrahepatic complications of non-alcoholic fatty liver disease.